Necrotizing fasciitis is primarily caused by two types of bacteria, Streptococcus pyogenes and Staphylococcus aureus. Both are cocci, so they are both round shaped, and both are gram positive, so they would appear purple with a gram stain, and both have two layers in their cell envelope. The outer layer being the cell wall containing thick peptidoglycan and acidic polysaccharide chains such as teichoic and lipoteichoic acid. And the inner layer is the plasma membrane made up of phospholipid bilayer and various proteins. Neither bacteria form endospores, so they don't have a dormant phase, and neither are motile, so they don't move around. They don't have anything like flagella or anything like that. Streptococcus pyogenes occurs in strands or chains of cocci. As you can see by the top picture on the right, while Staphylococcus aureus occurs in grape-like clusters of cocci, as you can see by the bottom picture on the right. Both pictures are gram stains, and you can see that they're both purple, so they're both positive. Streptococcus pyogenes expresses several virulence factors that enable the disease to progress, such as a cysteine protease called SPEB, enzyme that promotes the site of infection on the skin. And Staphylococcus aureus produces carbohydrate capsule, which helps it hide from host immune detection. And Staphylococcus aureus also contains many toxins. Prevalent one pertaining to necrotizing fasciitis is enterotoxin type B, which leads to toxic shock syndrome, which frequently accompanies necrotizing fasciitis.
On to the reservoir. The definition of reservoir is any person, animal, plant, or soil that an infectious agent can live and multiply. When it comes to necrotizing fasciitis, there are two responsible microbes. The main one is Streptococcus pyogenes, and its reservoir is the human skin and the mucous membranes. The other microbe is Staphylococcus aureus, and its reservoir is also the human skin. It isn't likely that the microbes will penetrate the skin, causing the infection. However, about 15% of the population have colonized Staphylococcus aureus on their skin, which means an open wound, or a person with an open wound coming in contact with them may cause the disease to become present.
And then transmission. Necrotizing fasciitis is primarily transmitted through bacteria entering a wound on the skin surface. These wounds can be from an insect bite, a cut, a burn, anything that allows bacteria to enter the body, basically. Both Streptococcus pyogenes and Staphylococcus aureus are frequently found as part of the body's microbiota. So if wounds are not cared for properly, these bacteria can infect sites of injury, and necrotizing fasciitis can occur and progress. Transmission of disease from one person who has necrotizing fasciitis to someone else through direct contact is possible. However, it is very rare unless the uninfected person has an open wound or many open wounds, such as chickenpox.
A lot of other infections have the same symptoms as necrotizing fasciitis, so it can be quite difficult to comprehend, although it does spread in a rapid amount of time. Early symptoms include erythema, which is redness and swelling of the skin. The individual may also feel severe pain beyond this red and swollen area. He or she will also experience fever, chills, and fatigue. Fatigue or extreme tiredness can be experienced earlier or later, whereas progressive or later symptoms include ulcers, blisters, skin discoloration making the skin turn black. These black spots are also known as necrotic scars, and as well as pus oozing out from the infected area. It's important to act fast when these symptoms are present. There are several ways to diagnose necrotizing fasciitis. This includes biopsy, which is extracting and examining cells or tissues to determine which kind of disease is present. Then we have blood tests and imaging, such as MRI scan and CT scan. So here is an example of a biopsy of necrotizing fasciitis. This one is a CT scan, and this one is an MRI scan of necrotizing fasciitis of the thigh.
Hello, my name is Haley Schaefer, and I will be talking to you about the prevention and treatment of necrotizing fasciitis. I have had a personal experience with this type of infection through an animal hospital I worked at in Las Vegas. The patient was Jackson Storm, a neutered male pug who was just under 3 years old. He developed the infection from a cat scratch on his back, and it quickly spread to his sides and belly. Images of Jackson Storm will be shown later, but I will give you notice and time to pause and cover your screen if you do not want to see them. There is no vaccine to prevent necrotizing fasciitis. However, good hygiene and proper wound care can do a lot for the control and prevention of this infection. All wounds should be taken seriously, including scrapes and blisters. After the wound has been cleaned, it should be covered and properly cared for to prevent any type of infection, not just necrotizing fasciitis. It is also important to wash your hands, whether you are handling infected tissue, cleaning a wound, or even using the bathroom. If you do have an open wound, it is important to avoid hot tubs, pools, and natural bodies of water. Bacterial outbreaks are common in hot tubs and pools, and natural bodies of water can be contaminated by humans and wildlife, increasing your risk of infection. In Jackson's case, he likely would have had a lower chance of infection if his wound had been cleaned. At the hospital, when myself or another assistant was scratched, we always took time to clean the wound, even if it was shallow. Unfortunately, however, it is harder for animals to tell their owners when they have gotten a small cut, particularly when it is where they are unable to lick. And his wound went unnoticed and untreated for some time. He presented to the hospital when his owner found a strange lump on his back, and after he was shaved, the truth was discovered. For the next few slides, graphic images of Jackson Storm's surgery and wound repair will be shown. Please take a moment to pause and cover the right side of your screen if you do not wish to see them. The primary treatment method of necrotizing fasciitis is surgical debridement, which is the removal of dead and damaged tissue. The sooner this is done, the greater the chance that the patient can make a full recovery. The patient may undergo multiple surgeries, the average being 3 within the first 12 to 36 hours. For the patient to make a full recovery, all of the infected tissue must be removed. This can result in extensive loss of tissue or even amputations. The first image of Jackson shows how he presented before his surgery. The grayish-brown and blackened tissue is all necrotic and infected. At this time, he was lethargic, painful, and had a fever. The second and third image shows the skin removed after his surgery. Around his belly, you can still see some grayish-brown tissue. This image was taken less than a day after his procedure when his dressings were removed, showing how quickly the infection had spread. The image on this slide was taken after his second and final surgery. As you can see, nearly all of the skin on his belly and sides has been removed on his right side. After the surgery, wet-to-dry bandages or packing is typically used to help promote recovery. When the infection is gone, skin grafts and plastic surgery may need to be done to properly close the wound due to the amount of tissue removed. Jackson Storm was given wet-to-dry bandages, which are changed daily. Then he was switched to polyurethane foam bandages, which allowed him to go home and return every 3 to 5 days for a bandage change. With each bandage change, he was given hydrotherapy and laser treatment to aid in his recovery. Antibiotic therapy should not be used alone, as it cannot properly penetrate the infected tissue, but it is great for management of the infection with surgery. What antibiotics are used will depend on the bacteria present, which is determined through a mixture of the patient's history, the gram stain results, and a culture. Some common antibiotics used before the type of bacteria is determined are ampicillin with clindamycin and metronidazole. These are used to help prevent this continued spread of the infection and control the toxicity. If the bacteria is gram-negative, ampicillin, sulbactam, and piperacillin tazobactam are used. For Staphylococcus, vancomycin or daptomycin and linezolid are used if the strain is resistant to vancomycin. Finally, clindamycin and penicillin are commonly used for Clostridium. Recovery from necrotizing fasciitis typically takes several months. In the case of Jackson Storm, who presented on July 24th, he is still in recovery from his debridement. At this time, the hydrocolloid bandages are used to prevent the wound while he finishes recovering. Jackson was a lucky case, and there is no doubt that the fast actions of his owner and doctor were vital factors to saving his life.